Hi, everyone, and welcome to another edition of College Matters Student to Student series, where we interview our former College Matters students and ask them about some of their experiences. So today we are joined by Molly, and Molly is here to
Hello.
talk about being in a nursing program. So, Molly, thanks so much for being here.
Yeah, of course. Thank you for having me.
Of course. So, a question I want to start with is what motivated you to become a nurse in the first place?
I did like a Yale. My friend's mom worked at like Yale for the nursing school there, and there was like a summer camp. So we went and got to just like see. It was they was we were looking at the nursing students doing their like summer camp, so we got to see it, and I think that was when I realized um, that is when I was like officially interested in nursing. I was like, wow, this is really cool. Like it was like a life-changing day, I would say, just because I was like it was really in my head that that's like what I was really interested in. And then from there, working with College Matters, I would say just like it kept progressing. Like I there was no other healthcare profession that I could really think of that I wanted to do. I thought about PA for a little bit, but I just stuck with nursing.
Got it. So you decided that nursing was the path for you.
Mhm.
And what extracurriculars did you do in high school that got your preparation started for healthcare and being of service to others?
Yeah, so typically my school allows like nursing students to do an internship during their like junior and senior year at like a local clinic. But because of COVID, I did not have that opportunity. So I sort of had to, I still wanted to build my resume other ways. So I found this program called like pre health shadowing, which was just like a virtual shadowing program where I got to see different speakers, which were nurses, like come in and talk about their day in the life or what specialty they were in and why they chose nursing, stuff like that. And then I also virtually attended Connecticut Nurses Association meetings. Like that, both of those just gave me really just some information. It wasn't experience, I guess, because I was just listening and watching these nurses talk. But the most, I guess, influential healthcare thing I did throughout high school was I held 3 blood drives with the Red Cross my senior year, and which were really successful. There were two just for my high school, and then we had another one open to the public. And then we also partnered with Be the Match, which is like the National Bone Marrow Donor Program. And so we had like the people that were donating blood also got to like swab their cheek and like sign up to be a potential bone marrow donor, which was really cool. So that in general, I mean, they're not really nursing specific, but I just healthcare experience in general was like really important for my resume.
Yeah, that's great. So, even though opportunities were kind of taken away
Right.
um, during COVID, you still found a way to at least get informed, right? I
Right.
think
Yeah.
even getting informed is a great use of your time. And I think Red Cross, for anyone who's thinking about getting started in nursing or somewhere in healthcare, I think Red Cross volunteering for them is a great place to start.
Yeah.
So you got some experience under your belt, and then you started searching for colleges. I'm curious, what were the key factors for you, particularly with nursing programs?
Yeah.
Um, and are there factors that you wish you had considered now that you're 1 year through nursing school? That you wish you had considered while you were in high school. So two-part question.
Yeah. So I feel like the one of the most important things for me, and I didn't really know about this until like I was working with College Matters, but um to find a direct entry nursing program was like really important because otherwise you can still get into that like college or university, but then you have to have like a high enough GPA or get all those prerequisites in before you can apply into nursing. So you don't start until some cases your junior year, which is a little bit delayed. And that's not a bad thing. I mean, every school has it the way that they do for that reason, but I just didn't want to have to go through that process. I wanted to start school like as a nursing major and then just have the 4 year program. So that was like a big factor for me. And it actually there was a couple of schools that I was really interested in that it kind of took them off the list because I was like, I you don't know, you might love the school and then you don't get into their program
Right.
or you have to apply late. It just added a lot more stress. I guess who knows what it would be like if I actually was in that experience, but just going through it, I just wasn't really interested in a non-direct nursing program. And then also another big factor for me was my school offers a study abroad program for the nursing students because my school has a campus in Ireland. So that was like unlike any of the other schools I had looked at. Typically, study abroad is like not offered to nursing students because they have to do their clinicals and stuff like that. Just like too like rigor of a program to like send the students abroad. But the way that my school works is we have a campus there, and then the nursing students have access to a hospital right there, so they can do all their clinicals while they're abroad. So that was really important to me, and I'm hoping to go next spring. So we'll see about that.
Great. So you've just finished your freshman year, like you
Yes.
said, and so what else will you do now to continue to gain experience in nursing?
Yeah, so I'll start clinicals next year. So this summer, I was thinking of like working as like a PCA or PCT in a hospital, like which are patient care
For people who don't
assistant.
know that,
Yeah.
what's PCA, PCT?
So PCA is a patient care assistant and a PCT is a patient care tech. They're very similar to like a certified nursing assistant or CNA, except without the formal certification of that. So a lot of nursing students do that to get some hospital experience, but I was thinking of it and then I realized that I wanted to have my clinicals through my school first this year and then consider that for next summer. Um, so I'll do that, and then I actually just applied for a internship for this summer, and it'll continue through the like school year as well. But it's for Parkinson's research with Parkinson's patients for clinical study. So it's an online internship, and so I'll be like meeting with patients online and going over some data and stuff to help build the clinical research study that they're doing with like the Institute of Neurodegenerative Disorders. So that is like a little bit of experience. It's not really hands-on, but I'm gonna just get some clinical experience this next year and then go from there because I'm sure even whether it's a hospital or clinic or primary care setting, I'll be able to do something.
Yeah, it sounds like to me, one thing I can kind of take away from this is every semester or summer, you're doing something, right?
Right.
To
Right.
just like continue to learn, continue to
Yeah,
gain experience. It
exactly.
doesn't have to be dramatic, right?
Yeah. I mean, and a lot of schools offer like fellowship programs. So like I know for where I go, the summer's going into junior and senior year, they will offer like something through the school, whether that's working at a hospital or something like that. And you can like pick your specialty and it's like an internship job there. So they'll like prepare you so you can get some more experience. So I mean, everyone kind of does it differently. Some people are really ambitious and like want to jump right in. Others are like, oh, I have my whole life to work in a hospital. So it's all how you perceive it and like how involved you want to be. But
Yeah. And I'm curious if you could leave us off with just one piece of advice for anyone who might be considering studying nursing in college.
well, the first thing I would say is if you're considering studying nursing, you definitely should apply to a nursing program because it's really hard. Well, I don't even know if it's possible depending on where you go, but once you're in school and you're not a nursing major starting off your freshman year, it's really hard to transfer into the nursing program. It's much easier to change your major out. If you're like nursing isn't for me, you can find something else. But if you're thinking about it, I definitely would say go for it. And then while you're in school, just to be motivated and remember why you want to be a nurse is really helpful. And it's hard school, but you'll definitely be able to get through it.
Yeah, and one of the reasons why it might be a good idea to apply directly into nursing as a freshman is, there are a lot of required courses that you have to take, and
Oh
there's
yeah.
also clinical experience that you have to do as well. And so I think that's great advice. It's better to start as nursing and transfer out than
Definitely.
try to transfer in.
Yeah.
Otherwise, maybe you can become a nurse starting in graduate school.
Right. Exactly.
Yeah.
Yeah, they have accelerated programs. So sometimes like if you're like, I'm not sure nursing is for me right now, you can become like a health science major and always do like a accelerated program later on. But if you're like not sure but on the fence, I would just you definitely should go for it because otherwise you might not be able to during undergrad.
Yeah. Yeah, I know someone who did an accelerated program. So that was
Yeah.
1 year.
Yeah.
And it was
So
pretty
hard.
intense,
Yeah.
right?
Yeah. Yeah.
You're in school all 4 seasons
Yeah.
and really grinding. But lots of ways to get this done. But I really appreciate your time.
Yeah,
Thanks so much
absolutely.
for
Yeah.
helping out these prospective students, and good luck to you for the rest of your college career.
Thank you so much. Good luck to everyone.